Thank you so much. Good morning, everyone, ladies and
Good
gentlemen.
morning.
I'm really pleased to be here, and I did say it out loud for a few people here that anything for the foundation. You've been very supportive to us in the ICU. I've jotted down a few things on paper because really I could speak to this topic all day and with limited time, so I hope you don't mind if I read a bit from that. I wanted to be able to get real information to you that I think is necessary. So again, my role as a manager of in the ICU is to oversee the day-to-day operations of the unit and to provide some supportive structure in terms of leadership to the staff, physicians, the patients, and the families. So in the intensive care unit, it's really a hectic and demanding, miracle-producing is one of the things that I think of it, and technologically sophisticated environment. And in this environment, we want the patients, the families, physicians to, they interact daily in terms of life-saving, life-altering treatments and interventions, and so our aim then is to deliver the, the highest quality in patient care and safety as we possibly can. Yet we still want all of our patients to experience the warmth and caring and compassion that as much as possible. Our ICU recently just experienced an increase in patient population coming in to see us, and on the one hand, that's not very good, but at the same time, knowing what we know of the population today in terms of the increased aging, et cetera, it's really important that we're able to provide a service for the, our patients in York and Richmond Hill. And so what we've done, we have a unit with 22 beds right now, but we're operating 16 beds. We've now recently increased it to 18 beds. With that, the acuity, of course, is much higher for our patients in the unit, and so there are certain equipments that are in very high demand. And one of the reasons why I actually agreed to come in is so that I could explain to you some of those equipments, and there are 3 of them especially. So we're able to accomplish what we do in the unit by leveraging evidence-based practice, using advanced knowledge and skills, treating our patients like human beings while keeping in mind their customs and cultures, and always respecting that. So using the latest technology, we're able to accomplish these goals, and it could be from one end of the spectrum as providing comfortable and dignified death, of course, in the presence of friends and family, to the other end of the spectrum where we're nurturing and we're sustaining life back to the best level possible and having people go home from there. Okay, so with those thoughts in mind, I'd like to then describe the 3 pieces of equipment. So one being the portable ultrasound machine, which is the picture you're seeing right now up on the screen. So ultrasound machine is used really to visualize various organs and blood vessels using high frequency sound waves. It's non-invasive, and this is to highlight various structures as well as function of that organ. In the ICU specifically, the ultrasound machine is frequently brought from bedside to bedside, and it's used to locate large central lines or central veins. So it could be in the upper part of the body, meaning the carotid or the subclavian veins, or it could be the femoral at the lower end. But either way, the intensivist, who is our physician, can get really quick, efficient access of that site by using the ultrasound to sort of probe the area, and then guided with a needle can go directly into the vein, as saying quickly and efficiently, because sometimes we really require life-saving drugs to be infused immediately. So on any given day, approximately 90% of our patients in the ICU will have that central line and really require this drug. Central lines also provide us with the opportunity to infuse multiple drugs in very large amounts of volume very quickly, and so therefore preventing cardiovascular collapse or any negative outcomes. So this is really an important piece of equipment for us. And I know our physicians are looking very much forward to having one in the ICU. The second equipment is our automated dispensing cabinet. This is something that every single ICU wishes and desires. The automated cabinet is a state-of-the-art piece of equipment. It's used collaboratively with pharmacists and nurses in the ICU. This cabinet is replenished by pharmacists. A pharmacy technician each day will go and replenish this. It's housed in various patient care units, so we'll have a few in the ICU, for example. And in the cabinets, we'll have individual patients' drugs, stock drugs, such as things that we, can grab from a shelf and pour, whether it's something like milk of mag, etc. And also the narcotic substances, which, as you know, we have to keep very tight control of and, you know, count of. So everything would be safely and securely housed in this piece of equipment. It is accessed securely and with individual unique access code and PIN numbers. So each staff will have their own, and there's a tracking from the moment you start entering until the end. We can also have printouts to see who's been accessing and how much use is gotten into the cabinet. So some of the outstanding advantages of this is basically the realities of fewer medication errors. That's a really big one. As you know, quality and safety is the important right at this moment. Also, fewer out of stock and fewer missing drugs. One of the key features of this particular equipment is if you go to one station and it's out of a certain drug or a narcotic, it will actually guide you to the next one that's got the supplies available. So it's really key. In addition, it's amazingly time-saving for nurses. When you think of the fact that right now what we're doing is we're writing orders, a physician writes, we go, we transcribe, we fax to pharmacy, pharmacy then sends to us either by tube. Could take anywhere from an hour or two really to get the medications that you need. Even when it comes to like stacked drugs that we need right away, this machine would be right there on site and we'll be able to access it. So very time sensitive. So the third piece of equipment then is the infusion pump, or the Symbic infusion pump. This pump is used to infuse electrolyte-enriched fluid, also blood products, amino acids or sugar, and lipids for our patients who are not able to eat by conventional means. Like you and I can enjoy a beautiful meal by mouth, digest, and really just enjoy it. But these patients, because of disease process, are unable to do that. And so we have to infuse the fluids into their veins. So one crucial use of the pump in the ICU, of course, is our life-saving and life-sustaining drugs, as I mentioned before. Patients come into the ICU, as you know, very critically unstable, very close to the point of no return at times. But miraculously, we were able to use this piece of equipment to infuse certain drugs, like, for example, Levofed. I know it means nothing to you, but that drug is a favorite drug for us in the ICU because, you know, somebody's blood pressure that's sitting at 40, 50, that's no good. And we have to get that up as quickly as possible. And so grabbing that bag of Levofed, putting it on the line and running it into the vein instantly can get the patient's pressure up to where it needs to be. And so that is the kind of equipment that we really, really need. In our ICU, each patient frequently requires approximately 2 to 4 IV pumps at their bedside. Wow. And with that, because of all the various drugs, like one patient could have 4 different inotropes, is what we call them, the life-saving drugs, as well as you have to provide food, plus regular maintenance fluid, antibiotics. Do you see what I mean? So all of that requires quite a few pumps at the bedside all at once, and everything infusing simultaneously, of course. With that said, then, the overall benefit...
Sorry.
Sure.
So this infusion pump takes a number of pumps and puts them into one unit?
No, it's individual pumps. As you can see, both sides have a place where you can put a line. So some of the pumps are individual with just one slide, and others have got both, 1, 2 sides. So in the ICU, most of ours will be a double pump. And so the lines are going through, especially in those areas there where it keeps track of the drips and the amount of drug that's going through. This pump is absolutely amazing. It's got even a drug library on it where we can program exactly what drug's being run, and we have to put in the weight of the patient and put in how much we want delivered to the patient, and the pump can generally do that on its own. Granted, we don't let the pump run on its own. We like to, of course, monitor it as well to make sure it's delivering, the appropriate amount of drugs, but it does a great job, a fantastic job. Okay, so the overall benefits of all these equipment in the ICU then correlates to positive patient care outcomes, of course. Outcomes such as improved quality, patient safety gains, and effective time-sensitive delivery of care for our patients. The additional benefits from all of this, of course, is happy families, right? Because they can get their loved one either taken home again or put a closure to something that might have been a really, long, drawn-out, agonizing type of situation. But overall, again, physician satisfaction and staff satisfaction and the manager's satisfaction is also quite important. So that's all I have right now, but thank you very much. And any questions that you might have, I'll certainly entertain.
A question about your patient population. Generally elderly, or across the whole board?
Yes, we are generally from, I'd see 50s up
That's
to
not elderly.
up to no, it's not. But the high 50s to 90s. You're not kidding. That is the younger population right now. But truly, it can go up until into the 90s.
Oh.
Yeah, because people are living much longer now with technology and with the quality of life that's happening out there, and we want to be able to give them that opportunity as much as possible.
I have a question. I don't know, I often get asked, how often do you replace these kind of equipment?
Right. And that's a very, very good question. They're replaced, I'm going to say now, like 10 years, over a 5 to 10 year span. And generally, the use of the equipment monitored very, very closely by our biomedical department. We work very closely with them. All the equipment's coming into the hospital first go through biomed just to be checked, quality, safety, and then brought to us. As we use the pumps or the automated machine, whichever equipment we have in the unit, we then have biomed come up regularly, scheduled checks. And so if something goes on the brink, of course, they're readily there and right in the loop, be able to help us.
Just further to the answer, this is Shabna CG.
Sorry, my
I'm
apologies.
the front staff. That's quite all right. I introduced you earlier, and it was a very nice introduction.
You mean I don't get to hear it?
I'll tell you later.
Okay.
The other thing about replacing the pumps is, and the urgency for York Central at the moment, is that the pump population has grown kind of like topsy, and over the lifetime of the hospital, we've managed to get ourselves to the point where we have 8 or 9 different models of infusion pumps. And that has all sorts of bad implications for staff training, for staff moving from one department to another and not being familiar with the pump, or worse yet, seeing a pump and saying a pump's a pump. And unfortunately, a pump's not a pump all the time. So part of this exercise, not only to get some of the features like monitoring drug dosages, guiding you to other pumps or other pumps that might be useful. Sometimes even monitoring dosage against weight of patient and that sort of stuff. Those are critical new features, but the basic thing is getting one standard pump across the hospital so that doctors and nurses and other staff affected, if they move from department to department or have to import a pump from another place because they're out of it's the same.
Critical.
The confusion I have is the hospital has ordered over 400 pumps, and this shows 133. So
we committed to fund to providing funds for a quarter of the required over 4 years.
So this is the foundations.
This is our nut for the year. There'll be another nut next year.
We bought it on credit. We have to pay it off.
Okay, so unless there are any more questions from you? No?
Thank you.
Okay, quite welcome.
Thank you,
Thank you
Roz.
for having me.
Thank you very
Appreciate it.